Have you ever leaned down to give your dog a kiss on the top of their head and gotten hit by something that stopped you cold? Not the usual dog breath smell. Not the familiar, vaguely meaty, slightly warm smell that every dog owner knows and mostly ignores. Something different. Something sharper. Something that made you pull back and look at them with your brow furrowed, trying to place exactly what that smell reminds you of. And then it hit you. Fish. Your dog's breath smells like fish. Distinctly, unmistakably, powerfully like fish. And your dog has not eaten anything fish-related in days. Maybe weeks. Maybe ever. So you chalked it up to something they ate in the yard. A piece of something unidentified. The kind of mysterious outdoor snack that dogs find and consume before you can intervene. You made a mental note. You moved on. But then it happened again the next day. And the day after that. And now it has been 2 weeks, and every time your dog pants near you or rests their head in your lap and breathes, that smell is there. Consistent. Persistent. Getting slightly stronger if anything. And you have started doing what every worried dog owner does at 11 o'clock at night. You typed it into the search bar. Why does my dog's breath smell like fish? And you got 100 different answers. Bad teeth. Diet. Something they ate. Normal dog breath. Nothing to worry about. And because none of those answers felt quite right, and because the smell has not gone away, you are here. Here is what nobody in those search results told you clearly enough. Fishy breath in a dog is not a breath problem. It is not a dental problem. It is not caused by what they ate in the yard last Tuesday. Fishy breath that persists, that returns day after day without an obvious dietary explanation, is your dog's body producing a specific, identifiable chemical signal. A signal that originates not in the mouth but in systems much deeper inside their body. Systems that, when something goes wrong with them, produce the exact chemical compounds that create that distinctive, unmistakable fish odor on your dog's breath. And some of those systems, when they are producing that signal, need your attention urgently. Hello everyone. I am Dr. Nathan Cole, and welcome back to Paw Secrets Lab. I have spent over 12 years in veterinary internal medicine with a specific focus on metabolic and systemic disease in dogs. And I want to be completely direct with you from the very beginning of this video. Persistent fishy breath in a dog is one of the symptoms I take most seriously when a pet owner describes it to me in clinical practice. Not because it always means something catastrophic, but because it is one of the body's most specific and most readable chemical signals. And reading it correctly can genuinely save your dog's life. What if I told you that the smell of fish on your dog's breath is not random? That it is produced by specific, identifiable chemical compounds, each of which originates from a specific biological process inside your dog's body? And what if understanding which compound is creating the smell in your specific dog gives you a precise map of exactly which internal system is struggling and exactly how urgently it needs attention? Today at Paw Secrets Lab, we are going to decode that signal completely. Here is exactly what we are covering. In Chapter 1, I am going to explain the chemistry of fishy breath. You are going to understand exactly which chemical compounds create the fish odor, where they come from inside the body, and why persistent fishy breath is a systemic signal rather than a local mouth problem. In Chapter 2, I am going to reveal the 4 internal sources. These are the 4 specific internal conditions that produce fishy-smelling breath in dogs, each with its own distinguishing characteristics and its own level of urgency. In Chapter 3, I am going to teach you the breath and body assessment. This is a specific 5-minute observation protocol you can perform tonight that identifies which of the 4 sources is most likely producing your dog's fishy breath and tells you exactly what to do next. And in Chapter 4, I will walk you through the emergency warning signs that demand immediate veterinary attention without waiting for morning, without waiting for a scheduled appointment, and without any further home observation. Subscribe to Paw Secrets Lab right now and join our incredible, growing community of educated, empowered pet parents. What you are about to learn could genuinely be the most important thing you have ever watched for your dog's health. Let us begin. Welcome to Chapter 1. The chemistry of fishy breath. To understand why your dog's breath smells like fish and what that smell is actually telling you, we need to understand the chemistry of what you are smelling. Because odors are not random. Every smell is caused by specific chemical compounds. And specific chemical compounds are produced by specific biological processes. When you smell something coming from your dog's breath, you are literally detecting the byproducts of what is happening inside their body. The characteristic fishy odor is produced primarily by a family of compounds called volatile amines. The most significant of these are trimethylamine, dimethylamine, and putrescine. These compounds are the same chemicals responsible for the smell of decomposing fish and seafood. They are produced naturally in the body as byproducts of protein metabolism and bacterial activity. In a healthy body, they are processed, neutralized, and eliminated efficiently through normal metabolic pathways. You would never smell them because the body handles them before they can accumulate. But when certain biological systems begin to fail, the processing and elimination of these volatile amines breaks down. They accumulate in the bloodstream. They reach concentrations high enough to be exhaled through the lungs. And because the lungs are continuously exchanging air with every breath, the accumulated amines are carried out of the body on every exhalation as a detectable, persistent, characteristic odor. This is the critical piece of information that changes everything about how you should think about fishy dog breath. The smell is not coming from the mouth. It is not caused by something between the teeth. It is not a dental hygiene problem that a dental chew will fix. It is being exhaled from the lungs because the compounds creating it have accumulated in the bloodstream to detectable concentrations. You are literally smelling your dog's blood chemistry on their breath. And the specific internal systems responsible for processing and eliminating volatile amines in the body are the kidneys, the liver, the anal glands, and in female dogs, the reproductive system. When any of these systems begins to malfunction, volatile amine accumulation follows. And fishy breath follows the accumulation. Now here is what makes this clinically significant beyond simply identifying the source. The kidneys and liver are the body's two primary detoxification and filtration systems. They are the organs responsible for processing virtually every metabolic byproduct that the body produces. When either of these organs begins to fail, the signal is not immediate and dramatic. It is gradual and subtle. It builds over weeks and months as function declines slowly. And one of the earliest detectable signals of that declining function, sometimes the very first signal that owners notice before any other symptom appears, is a change in the character of their dog's breath. Fishy breath may be the earliest warning your dog's body is capable of giving you about a developing internal problem. And you noticed it. That matters profoundly. Welcome to Chapter 2, where the smell is actually coming from. I am going to walk you through each of the 4 internal sources of fishy breath in dogs with the specific distinguishing characteristics of each. Pay close attention because the accompanying symptoms that come with each source are your diagnostic map. Internal source number 1. Kidney disease and uremic breath. This is the source I want you to understand most completely because it is the most medically serious and the most commonly missed early warning sign in dogs. When the kidneys begin to lose their filtering capacity, a condition called uremia develops. Uremia means the accumulation of waste products in the blood that healthy kidneys would normally filter and eliminate through urine. Among these waste products are urea and the volatile amines we discussed in Chapter 1. As these compounds accumulate in the bloodstream, they are exhaled through the lungs and detected as a distinctive breath odor. The breath odor of kidney disease has 2 components that overlap. There is the fishy quality from the volatile amines. And there is a second quality that experienced clinicians describe as ammonia-like, metallic, or urine-like underneath the fishy note. Some owners describe it as smelling like the inside of a refrigerator that needs cleaning. Others describe it as chemical or slightly bleach-like underneath the fish smell. The accompanying symptoms that specifically suggest kidney disease alongside fishy breath are these: dramatically increased thirst and dramatically increased urination occurring simultaneously. Your dog drinking from their water bowl more frequently than ever before while also urinating in larger volumes and more often. This pattern of increased intake and increased output is one of the most classical early presentations of kidney disease in dogs. Weight loss that is gradual and unexplained despite normal, or even increased appetite. Vomiting that occurs periodically, particularly in the morning before eating, and that is not associated with any obvious dietary cause. And a general subtle decrease in energy and enthusiasm that owners often initially attribute to aging rather than illness. If your dog's fishy breath is accompanied by any combination of these symptoms, Please call your veterinarian tomorrow morning for a blood panel and urinalysis. Kidney disease caught in its early stages is an entirely manageable condition with dietary modification, appropriate supplementation, and veterinary guidance. Kidney disease discovered late offers dramatically fewer options. Internal source number 2. Liver disease and hepatic breath. The liver is involved in metabolizing sulfur-containing amino acids that, when improperly processed, produce volatile sulfur compounds including dimethyl sulfide, one of the primary components of the Fishy odor family. When liver function is compromised, these compounds accumulate and appear on the breath. The breath odor associated with liver disease has a slightly different quality than kidney disease breath. Clinicians often describe it as musty, sweetish fishy, or having a faint decay-like undertone beneath the primary fish smell. Some owners describe it as almost like old garbage with a fish note rather than the cleaner chemical smell of kidney disease breath. The accompanying symptoms that specifically suggest liver involvement are these: yellowing of the whites of the eyes or the gums and inner ear skin. This yellow discoloration is called jaundice, and it indicates bilirubin accumulation from impaired liver processing. Abdominal distension, a visibly swollen or rounded belly that is new and not related to weight gain. Profound behavioral changes including confusion, disorientation, circling, or pressing their head against walls or furniture. These neurological symptoms can occur in advanced liver disease when ammonia from impaired liver metabolism crosses the blood-brain barrier. Any combination of fishy breath plus these symptoms is a same-day veterinary emergency. Internal source number 3. Anal gland problems. This is the source that surprises most dog owners the most completely. And it is far more common than kidney or liver disease as a cause of persistent fishy breath in otherwise healthy dogs. Your dog has 2 small glands located just inside the rectum on either side of the anal opening at approximately the 4 o'clock and 8 o'clock positions. These anal glands, also called anal sacs, produce a thick, intensely pungent secretion that in a healthy dog is expressed naturally during bowel movements. The secretion is used for territory marking and individual dog identification. It is the reason dogs greet each other by sniffing each other's hindquarters. Each dog's anal gland secretion is a unique chemical signature. And that secretion smells powerfully, unmistakably of fish. When anal glands fail to empty naturally, whether due to soft stool that does not provide enough pressure during defecation, due to gland inflammation, or due to gland anatomy that prevents natural expression, the secretion accumulates. The glands become impacted. And dogs respond to the discomfort of impacted anal glands in a very specific and revealing way. They lick. Specifically, they lick the area around their rectum and their hindquarters with focused, repetitive attention. And when a dog licks their anal glands and then breathes on you, you smell exactly what you have been smelling for 2 weeks. The distinguishing characteristics that point specifically to anal gland issues rather than kidney or liver disease are these. You notice your dog scooting their hindquarters along the floor or carpet. You observe frequent licking of the hindquarter area. The fishy smell is strongest immediately after they lick themselves rather than being present constantly throughout the day. And importantly, your dog is otherwise completely well. Eating normally. Drinking normally. Energy levels completely unchanged. The fishy breath is isolated and intermittent rather than constant and progressive. Anal gland issues are uncomfortable and become genuinely painful if allowed to progress to impaction or infection. But they are entirely resolvable with veterinary anal gland expression and dietary modification to produce firmer stools that provide adequate natural pressure during defecation. Internal source number 4. Reproductive system conditions in female dogs. In unspayed female dogs, fishy breath can be produced by conditions affecting the uterus. The most serious of these is pyometra, which is a life-threatening uterine infection that develops in unspayed females, typically in the weeks following a heat cycle. Pyometra produces a distinctive combination of vaginal discharge that smells powerfully of fish and decay, systemic illness from the bacterial toxins entering the bloodstream, and breath that carries that same fishy decay quality from the systemic absorption of bacterial byproducts. Pyometra is one of the true emergencies in small animal medicine. A dog with pyometra can deteriorate from visibly unwell to critical within hours. If you have an unspayed female dog whose fishy breath appeared in the weeks following her most recent heat cycle, and she is simultaneously showing any signs of vaginal discharge, lethargy, vomiting, or dramatically increase thirst, please do not wait. This is a same-day emergency clinic situation without exception. Welcome to Chapter 3. The Breath and Body Assessment. Armed with everything you now know about the 4 internal sources, I am going to walk you through a specific 5-minute observation protocol that tells you which source is most likely responsible for your dog's fishy breath and exactly what level of urgency applies to your situation. You do not need any equipment for this assessment. You need your senses, your memory, and the observation framework I am about to give you. Assessment Step 1. Characterize the smell precisely. Get close to your dog's mouth, ideally when they are panting, and breathe in deliberately. Try to identify the specific quality of the smell beyond simply fishy. Is it a clean, chemical, ammonia-like fish smell? This points toward kidney disease. Is it a musty, sweetish, slightly decaying fish smell? This points toward liver involvement. Is it a pure, strong fish smell that is most intense after your dog has been licking their hindquarters? This points toward anal glands. And if you have an unspayed female, is there a decay note underneath the fish that is accompanied by any discharge? This is the pyometra signal that requires immediate action. Write down your specific characterization. The exact quality of the smell matters diagnostically, and your veterinarian will ask about it. Assessment Step 2. The Drinking and Urination Inventory. Over the next 24 hours, track your dog's water intake and urination frequency consciously and deliberately. You do not need to measure volumes precisely. You need to answer 2 questions honestly. Is your dog drinking noticeably more than usual? And is your dog urinating more frequently or in larger volumes than usual? If the answer to both questions is yes, and this pattern has been present for more than a few days, this combined finding alongside fishy breath elevates the urgency of a veterinary appointment to this week rather than eventually. Assessment Step 3. The Gum Color Check. Lift your dog's upper lip and look at the gum tissue above the upper teeth. Healthy dog gums are bubblegum pink, moist, and consistent in color. Look specifically for any yellow tinge to the gum color or to the whites of the eyes. Jaundice in these tissues indicates bilirubin accumulation from liver involvement. If you see any yellowing alongside fishy breath, this is a same-day veterinary appointment, not a scheduled one. Also assess gum moisture. Press your fingertip against the gum for 2 seconds and release. The area should return to pink within 2 seconds. A return time of more than 2 seconds indicates dehydration that, combined with fishy breath and other symptoms, requires immediate professional assessment. Assessment Step 4. The Hindquarter Observation. Watch your dog for 15 minutes in a relaxed environment. Are they scooting? Are they licking their hindquarters with focused repetition? Is the fishy smell noticeably stronger in the room after they have been licking themselves than it was before? If your answers are yes, anal gland involvement is highly probable and your veterinarian needs to examine and express those glands at your next appointment. Also visually check the fur around the anal area for any evidence of swelling, redness, or discharge from the gland openings. Visible swelling or discharge from the anal gland area indicates impaction that has progressed to infection and requires veterinary attention this week. Assessment Step 5. The Behavioral Change Review. Think carefully and honestly about the past 2 to 4 weeks. Has anything changed in your dog's behavior or daily patterns alongside the fishy breath? Energy levels, appetite, sleep patterns, interaction with family members, any new reluctance to exercise, any new stiffness or apparent discomfort, any episodes of vomiting or unusual digestive behavior. Write down every change you identify, however small and however uncertain you are about its relevance. Changes that seem minor in isolation frequently become diagnostically significant when your veterinarian sees them as a pattern alongside the primary symptom you are reporting. Your observations are clinical data. Treat them as such. Welcome to Chapter 4. When fishy breath is a same-day emergency. I have structured this video carefully to give you the knowledge to assess your dog's situation accurately. But there are specific combinations of symptoms that eliminate the need for home assessment entirely. These combinations require you to stop everything, call your veterinarian or an emergency animal clinic, and go there now. If your dog's fishy breath is accompanied by visible yellowing of the gums, whites of the eyes, or skin inside the ear flaps, go to a veterinary clinic today. Jaundice combined with metabolic breath odor indicates liver failure that is progressing. This is not a wait-and-see situation. If your dog has fishy breath and has not urinated in more than 12 hours, this combination can indicate a urinary obstruction or severe kidney shutdown. A dog that cannot urinate is in a life-threatening situation. The toxins that healthy kidneys remove continuously are accumulating in the bloodstream at a dangerous rate. Do not wait for morning. Go to an emergency clinic immediately. If your dog is showing neurological symptoms alongside fishy breath, including walking in circles, apparent blindness or confusion, pressing their head against walls or furniture, or seizure activity, these symptoms indicate that metabolic toxins have crossed the blood-brain barrier. This is a critical emergency regardless of the time of day or night. If you have an unspayed female dog with fishy breath and any vaginal discharge whatsoever, combined with lethargy, or vomiting or dramatically increased thirst, assume pyometra until proven otherwise and go directly to an emergency veterinary clinic. Pyometra kills dogs who are not treated promptly. There is no version of this symptom combination that warrants home observation. If your dog's fishy breath appeared suddenly and intensely rather than gradually building over days and weeks, sudden onset of strong metabolic breath odor indicates an acute process rather than a chronic one. Acute kidney injury, acute liver insult from toxin ingestion, acute infection. Sudden and severe always warrants same-day assessment. And if your dog collapses, loses consciousness, or shows extreme weakness alongside any breath odor change, please call an emergency veterinary clinic while you are already putting your dog in the car. Time is the only variable that matters in those moments. You came here today because of a smell. A smell that bothered you enough that you did not just accept it and move on. That you did not just reach for a dental chew and decide the problem was solved. That you felt in your gut was telling you something beyond what the surface answer explained. That instinct was correct. And following it here tonight was one of the most important things you have done for your dog in a very long time. Your dog cannot tell you that their kidneys are working harder than they should. They cannot explain that their liver is struggling to process compounds it used to handle effortlessly. They cannot describe the discomfort of impacted anal glands or the brewing infection of a condition that, untreated, will become critical within days. They live completely in the present moment, wagging their tail, pressing their warm head against your leg, trusting entirely that you will notice the signals their body sends and know what to do with them. You noticed. You asked a better question? You did not accept. Just bad breath. As a complete answer because your instinct told you it was not. The chemistry of your dog's breath is a window into their internal health that most owners never think to look through. But you look tonight. You learn the difference between the clean ammonia fish of kidney stress and the musty sweet fish of liver involvement, and the pure strong fish of anal gland impaction. You learn to check the gum color, to track the drinking, to watch the hindquarters, to document the behavioral changes. You are leaving this video with a clinical framework that most dog owners never acquire in a lifetime of pet ownership. That knowledge belongs to your dog now. Because you are the one who carries it for them. Tell me in the comments below. How long has your dog had this fishy breath? Did the assessment in Chapter 3 point you toward any of the 4 sources? Did you notice the yellowing, the drinking changes, the hindquarter licking? Your answer in your dog's story might be the exact thing that prompts another owner reading these comments to finally make the veterinary appointment they have been putting off. If this masterclass shifted something for you tonight, if it turned a vague worry into a clear direction, please tap the like button. It tells the YouTube algorithm that real, specific, potentially life-saving veterinary education deserves to reach every dog owner who needs it. And right now, somewhere out there, a dog is breathing a signal that their owner has been dismissing as normal. Help us reach that owner. Subscribe to Paw Secrets Lab and join our extraordinary, growing community of educated pet parents who refuse to accept incomplete answers about the animals they love. I am Dr. Nathan Cole. Check those gums tonight. Track the drinking tomorrow. Watch the hindquarters. And if anything in this video made your heart rate increase, if anything matched what you have been seeing, please call your veterinarian first thing tomorrow morning. Do not wait for the next available appointment 3 weeks from now. Tell them exactly what you have observed and exactly why it is urgent. Your dog trusted you to notice. You did. Now act on it. I will see you in the very next video.